That is something that we're big on, is always talking about what the transformation is like and how the woman is going to feel when she walks in the door, and whether that comes down to a calming atmosphere. It's definitely one-on-one and more personalized, although we do small group classes with only 4 people. But we want the woman to feel more energetic and also after they're done with us and walking out the door, happier than they came in.
On Andalone, welcome to the podcast.
Thank you, Jimmy.
So it's still PT Pintcast, but we're doing this different types of episodes. These are called PT Business Blueprint. I told some people in previous episodes, I'm on a mission, 1,000 episodes with clinicians, clinic owners, people who are doing the thing in business and in healthcare. I want to do 1,000 episodes in the next, 5 years. Is that ambitious? Yes. Am I ambitious? Also, yes. So let's start with the back of the baseball card. Tell us about your business, how long you've been doing it, what's it called, where are you? Like, what would you like? What's the tea that you'd spill to a colleague if you ran into them, and how would you explain it?
Yeah, I would explain it as I own a women's health and wellness practice in northern San Diego area, Encinitas, California. And we help women avoid painkillers, medications, and really get long-lasting results. And doing that through Pilates-based exercise, massage, and pelvic floor therapy.
So say that again, because I love your statement. Let's say it one more time. We help women, because I love when people say this instead of saying I have a physical therapy clinic, which really doesn't say anything. It's like saying I have a toothbrush. It's like, okay, but what do you do with it? How does it make my life better? So say it again, because I loved it. So I help women.
I help women avoid medications and surgery, get long-lasting results so they can live a happy, healthy life. And we do that through Pilates-based exercise, pelvic floor therapy, and massage.
Love it. Perfect. And did you say the name? What was the name of your business?
Level Four PT and Pilates.
Well, I've got to ask, why Level 4? Because it's like, it's, you know what I mean? Like, why Level 4? I like it.
Honestly, it goes back to nothing that had to do with the business. It was something that my husband is actually a PT. We're business partners together. And it came about from seeing a name of a restaurant a long time ago. But then our philosophy has always been, in a traditional PT setting, you never get people that ability to be 100% when you're working with insurance. So how can you really get people to the more performance and lifestyle aspect and carry that through long-term benefits? And so it goes now upon our Pilates classes and how we do it, with Level 4 being the highest level.
Got it. Okay, cool. I like it because it's not just like, I don't know. I sort of get bored at like boring names, right? Like, Main Street Physical Therapy, which has its place, right? But I do like it when it's a little bit off center and off the beaten path. So why that type of PT? What about it like resonates with you? Why pelvic floor? Why helping women?
Well, part of it came first from my background. I was always obsessed with fitness, and I was a dancer way back when, was introduced to Pilates. And when I started working with Pilates instructors, and I was in a clinic setting in Newport Beach, California, an amazing setting with a Pilates studio, I really saw the outcomes that people were getting past the insurance model, where long-term results would happen with back pain or any other kind of orthopedic condition. And then after I had my kids, I got more into the pelvic floor specialty. And then with pelvic floor and Pilates, having that really see long-term results with incontinence, prolapse, postpartum care, menopausal care, so many different benefits.
Okay, so no two PT clinics are alike, right? Even if I had 100 clinic owners who are all specializing in sort of the same type of patient you are, they'd still be different. There'd still be 100 different variations. So how would you describe what it's like on the inside? Is it one-on-one? Is it just you? Like, who are the people? And then describe your product. You can't just say physical therapy because it's different, but how would you paint a picture of what Level 4 looked and felt and tasted and smelled like?
That is something that we're big on, is always talking about what the transformation is like and how the woman is going to feel when she walks in the door. And whether that comes down to a calming atmosphere, it's definitely one-on-one and more personalized, although we do small group classes with only 4 people. But we want the woman to feel more energetic and also calm after they're done with us and walking out the door, happier than they came in.
I like that. All right. So you said classes. So like what's on the menu? Like if someone were your ideal client and you were to show them sort of the menu, right? Like what's on it? I know when I walk into Starbucks, I know I can have the venti grande. I forget what those different sizes are, right? I can get coffee. I can get it on ice. I can get it hot. I can get food. Like what's on the menu at Level Four?
On the menu would be you can start your journey on the Pilates side of our business. We do
I like
always
that.
screen every client we see, and we do this to help them and tell them also too that if we're giving them an option of what to choose from, but we're going to give our best recommendation in order to get them long-term results a lot faster. So we may recommend them starting with the physical therapist first, but they don't have to. If they do, though, they would go through our physical therapy program and work with our PT one-on-one. And then we also offer sessions one-on-one with our Pilates instructors, and they can also do small group classes. So they may come in through the door and sign up for Pilates only, or we may recommend they go one-on-one with the PT.
Yeah. I like that. This reminds me of a friend's clinic, and I'm using air quotes because she runs. It's called Mind the Mat in Alexandria, Virginia. It's a
Oh, yeah.
Pilates studio.
Mhm.
Do you know Megan?
I don't know her personally, but I do follow her. Yes,
Yeah,
she does
I
an
mean,
amazing job.
same thing, right? So I call her like a sucker punch, right, or a Trojan horse, which is like you walk in the door and you're like, I'm at a Pilates studio, and meanwhile, a PT has their eyes on you, and they're like, okay, I see what I'm doing here.
Yeah.
So that PT, right, in a different way, you can provide physical therapy and value as a physical therapist, and you don't have to just do it in a clinic, right? Using air quotes on a podcast. So let's talk about two of the biggest pain points in business in our profession, and maybe you face them because organizations that are big or small maybe have to face them. And the goal of these episodes is to give like sort of tactical examples. We actually learn more, I think, in the failures than we do in success. Success is sneaky, man. It doesn't really teach us a whole lot. Actually gives us like some false confidence. It's like, oh, I don't need any help with this. I'm super good at it. But success makes us work. So the two biggest pain points we're talking about these days are, how are you finding patients, and how are you finding other people to come in and work, the right people to work in your organization? So let's do patients first. How are people finding out about you? What are the different ways? What are the things that you do to make sure the right people understand, know who you are, and when they need you, they show up? Listening, if you're running a PT practice and you're still using old school systems, you're leaving time and you're leaving money on the table. Empower EMR is here to change that. It's an all-in-one, automated and built to streamline your scheduling, billing, and everything else so you can focus on what you do best, helping patients. Don't overthink it. Go to empoweremr.com. That's empoweremr.com. Book a demo and stop letting outdated tech hold you back. All right, PTs, if you're serious about crushing the OCS exam or leveling up your clinical game, Current Concepts of Orthopedic Physical Therapy, 5th edition, is where it's at. This is your one-stop shop for the latest in ortho PT, with expert insights on every joint, real-world case scenarios, and evidence-backed techniques. Don't sleep on this. Go to orthopt.org right now and get a sneak peek and start prepping like a pro. That's orthopt.org. One more time, orthopt.org. Go there.
Yeah, this is true for any business owner and any PT that wants to go into business. Is you have to learn marketing, and learning digital marketing in this day and age is the best way to do. So we do a whole variety of ways to talk to the consumer directly instead of going straight through other practitioners to get referrals. Those are nice too, but we don't rely on that. So Google Ads, Facebook, Instagram, outreach, doing community events, anything that we can do to network with like-minded practitioners that work outside the box as well.
Now, let me ask something tactical. Are you doing that? Is someone else at your organization doing that? Like, who is fingers to keyboard, or is this a third party? Neither is a bad answer.
We do have marketing assistant
Good,
running
good.
Google ads and doing more of the tech stuff because I don't know how the intricacies of doing that, and they can do it better than me.
Yeah.
I do handle a lot of the marketing now because I am not treating as much anymore, and it's also just trial and error of learning what's worked over the last 8 years because a lot of things have not worked. So now it's a lot more streamlined, and the people that we have helping us, we
Yeah.
understand it better how to outsource that stuff.
If you were to say like, and this is just for you, it's always this is not the silver bullet because there isn't one. Some people find better success in their area, in their niche, whatever, with a channel. But if you had to pick one channel, you get to dump everything else. You only get to pick one way. What's the thing that works the best for you?
I would say Google, because people are
Google.
searching for a problem, and then from there we're matching to what their problem is, how we can help them.
We are the solution. We are the answer geographically, time, it's time and space and issue. All right, so let's go to the other side of the coin. How many people work with you at Level 4 right now, and who are the people in the neighborhood?
Yeah, I have 3 amazing Pilates instructors. I have a full-time PT, and we just brought on a PTA who is also a Pilates instructor. So
So it's
everyone is trained as a Pilates instructor, but a PT and a PTA.
so it's you plus 5, so we got 6 at Level 4.
Yep.
Perfect. And then when you did need to find someone, what's the way you do that? How do you present yourself? Because this is one of the biggest issues. People will say, "Man, I'm losing money," but it's because I've got so many clients that I have to turn some of those people away. So when you do need to dial it up and find someone, what do you do? Right? There's no magic bullet. How do you find the right person to bring them on board?
My husband's great at that. He created like this whole hiring process. And so we really, after 8 years, you learn, because that is honestly the hardest thing about business is finding people, keeping
Yeah.
people, keeping the right people, and having them stay as amazing practitioners within your space. So it's going and posting ads that are really going to speak differently than other ones, and being really fine-tuned on what you need them to do and how you need them to help in the business. And also too, thinking about it from their point of view and them looking for a job, what would be enticing to them.
Yeah.
So it goes down to how you're advertising it.
Yeah. Communicating from understanding who. Simon Sinek, have you ever heard like Simon Sinek starts with why?
Yeah.
And I kind of disagree. I think why is terribly important. I think things really start to move when you get to why. But in my opinion, you have to start with who. I think it starts with who. And then next is what are their problems, as you talked about Google being your biggest driver of patient acquisition. I think I asked the question what twice. So you have who, what's their problem, and what's my solution? Do those things cross? If they do, that is our why. That is our shared why. So while I do appreciate Mr. Sinek's, it starts with why. I think you have to do a little bit of work. You got to ask a couple questions before that. Who am I seeking to serve? What is their problem? I like to picture that Venn diagram, right? 2 circles. List every one of your ideal patient's problems on it. Boom, put it all in one circle. Put all of your strengths and your abilities and your benefits, your reason for being on the right side of that Venn diagram. And then whenever those 2 things cross over, they seem similar, put that in your middle. And there's your mission statement. Say it again. We help women.
Here's a question for you. Do you want to boost your clinic revenue by $290 per patient per quarter? Of course you do. That's rhetorical. Physiotech's remote therapeutic monitoring can help you do that, enhance patient outcomes, ease provider workload, and turbocharge your earnings. Kickstart with RTM at physiotech.ca. That's physiotech.ca. And the thing you interact with the most at your clinic, if you're a therapist, like it or not, is your EMR. MW Therapy's all-in-one outpatient PT EMR gives you seamless integration of patient portals, marketing automations, and billing, all at one unbelievable value. Switching over is a breeze too. Kick the tires, take a test drive at mwtherapy.com. And where is your PT career going? It's not rhetorical, it's literal. Embark on extraordinary patient care adventures with Jackson Therapy Partners. Visit them at jacksontherapy.com. This is perfect for physical therapists eager to make their mark, to do what you want to do, where you want to do it. Discover where your career can take you at jacksontherapy.com.
We help women avoid medications and surgeries so they can have long-lasting results and live a happy, healthier life.
So it sounds like you did that, whether you did to, like I do with a dorky Venn diagram or not, you did that. You said, what are their things that they're worried about or want to achieve or where they're stuck? And you said, I can help you prevent those things. And that's how you get to a statement like that. You don't have to be formulaic, right? Some people are like, well, I need an elevator pitch. I'm like, yeah, I don't know. It's a sentence, man. Say a couple things. So well done on doing that. So, all right. So we need to tap into your husband's standard operating procedure for finding great people, or the general idea is pay attention to what the ideal person might feel like or be driven by. Write the ad for that person. The ad is not for you. The ad is for them always.
Yep.
All right.
Yeah, I think
how
when
long?
you
Go ahead.
I was just going to say, when you think about when you're trying to attract the right client to your place, it's the same thing with hiring. You
Same
want
thing.
to be able to talk about how it's going to benefit them too.
Yeah, don't overcomplicate it. I'm not, marketing communications is simple. Doesn't mean it's easy. It's simple, right? And the first slide I put up whenever I'm giving a presentation to people who are comfortable marketing or not comfortable marketing, or even people who are like, marketing, we don't need marketing. Great. The first slide I always put up is 2 tin cans connected with a string. I said, don't get it twisted. This is what you're doing. You're sending a message from one person to another, right? Now that message has a better chance of landing if it's written for me, the receiver, and not just you, the sender. So it sounds like you understand that. Let's talk things that you didn't see coming. What was the biggest thing in owning and running a business full time, this being your thing, that you didn't see coming? The biggest thing that you said, oh man, I did not understand that this was not in the brochure.
Yeah, I think if you would have asked me 10 years ago, I would have said I'd always be a solopreneur. So it's definitely people. You will get hit with the people you think are so loyal to you or really get close to, and things will smack you in the face one day.
Yeah. And you have to just, as we like to say, figure it out.
You do. You figure it out and you keep going.
How about the most rewarding? What's been the most rewarding part? And I'll preface this by saying you can't say, because table stakes is helping people, right? Helping patients. That's got to be out. Like that's like now, that's like when Wheel of Fortune gives you like RSTLNE. They give you like some letters that are just those are table stakes. What's been the most rewarding outside of being able to help people?
I would really say self-development, like how both my husband and I have grown as people, and like really seeking out, because when you're not getting outcomes, it's like you have to reflect back and look at yourself. What could you be doing better all the time, and which really makes you grow as a person.
Yeah. Who knew that thing that they made us do in PT school, which is like reflection, the thing that I avoided like the plague, is actually something that could help us. But in PT school, we didn't have 2 free minutes to rub together. I'm not saying that running a business, you have 2 free minutes to rub together, but you understand the value of like, hey, if I pause here, if I sharpen my axe, I could actually chop more wood later instead of just chopping wood with a dull axe. That's the analogy that I sort of use in terms of like, okay, if I pause and reflect, maybe I can actually do and jump more. Last thing we'll do before we do parting shots. What's the advice that you'd give to someone who's listening, who I call them they're on the edge of a diving board. They've been thinking about it. They're flirting with jumping into the deep end of the pool because you can't really be you can't be half wet when you're in a pool, right? You're either owning a business or you're not, right? So what's the advice for the person on the edge of a diving board who's thinking about doing something similar to what you've done?
You have to realize that you're not going to always get quick results. Like when you commit to something, you have to do it on the days that maybe you don't like what you're doing, and just keep going, and always go back to like your purpose of why you're doing it. And when you see that long-term result, focus on that when things really suck sometimes as a business owner.
Love it. All right. Last thing we do on the show, I always ask for a parting shot. Favorite quote, mic drop moment, soapbox statement. What do you think about? Are there words or an idea that you come to when things get hard to keep you going through, the suck?
I would say, when you can't just stop, you have to keep going, and perseverance beats everything.
It sounds like Finding Nemo, right? Just keep swimming.
Just keep swimming. I like that. Yeah.
Dawn, Level 4, appreciate you coming on here for one of our PT Blueprint episodes and just sharing what you do and how to do it. Really, my goal is to show people like, hey, look, real people. These aren't just people on websites. Like, these are actually, look, Dawn's a real person. She didn't know if she could do it, and then she did it, and she's still doing it. So maybe there'll be more people like Dawn 5 or 10 years from now because they heard this episode. So appreciate you sharing and peeling back the curtain a little bit to show people what's possible.
Thank you. Appreciate it.